Hello, my name is Jamie McClelland. My student ID is 367439, and today's date is October 26, 2020. Today I'll be demonstrating for you medication administration via the IV piggyback. Before I get started, I'm just going to show you a scan of my room. So this is my office space with all the supplies I need for the assessment. And then around me, it's an office, so it is dirty, nothing on the whiteboard, but there is a bit of a mess here, but this is our station and it is quite clear there. Okay, before I get started, I'm just going to use hand hygiene. Always better to use than not use, especially with all this COVID stuff going on. So make sure you get it in all the nooks and crannies and make sure it dries. Perfect. So we have Allison Chinook. This is the scenario. Allison Chinook is a patient who is being admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 1500 and Allison is due to receive an antiemetic 6 hours after her first scheduled chemotherapy. I've signed it here with my student ID there. We can put that off to the side now. And now we just need to go to the doctor's orders and read those and then also go to the MAR. So we have Allison Chinook. She was admitted today, so October 26, 2020. Her birthday is December 11th, 1960. And she is here, was admitted today for chemotherapy and symptom management. She has no known allergies. And then we have the goals of care here, and we also have the medications here, and it looks like she's supposed to start a lot of medications today, but for us we're just going to be doing the ones at 1300. So on the MAR here we'll go to 1300 and we see an IV piggyback here for dexamethasone, which is what we're using for the assessment today. 4 milligrams IV piggyback every 6 hours after chemotherapy on today's date, which is October 26, 2020. So this is the box we're looking for, and it hasn't been given yet, so we're safe to give it. And we just want to check on the doctor's orders here too to make sure that we're giving dexamethasone 4 milligrams IV piggyback every 6 hours after chemotherapy to start today on October 26, 2020. So that's perfect. That we have we're matching there. It also says every 6 hours. Okay, so we just want to make sure that nothing has been the dexamethasone hasn't been given within 6 hours. And here we are. We have dexamethasone 8 milligrams IV piggyback one time prior to chemotherapy, given at 900, and that's 6 hours, so we are safe to give our dose at 1500. Okay, so after we know that we are giving the right person the right drug and what we're looking for, we also want to go to the drug monograph and make sure dexamethasone is okay to give in the way that we want to give it. So I just have the one dexamethasone here printed, and it says we can do it through intermittent infusion, which is what we want. It says antiemetic, which is what we're using it for. 8 to 20 milligrams before chemo. We know that she had here on the MAR 8 milligrams before and 4 milligrams after every 6 hours. Yes, correct. We have that here. It is safe to give with an IV infusion 5100 milliliter mini bag to infuse over 20 to 30 minutes, which we have the bag here, and it is 50 milliliters that we're going to use. The dilution we can use for dexamethasone is D5W, NS, dextrosaline, or combination of lactate ringer solution. And today we're going to use 0.9% sodium chloride. Okay, so now that I have those and I have the drug monograph here for dexamethasone, we just want to go through the checks on our normal saline. So right here we have 0.9% sodium chloride. We're going to give it through IV piggyback, which is safe and safe. We have 50 milliliters, which is safe here. And then the expiry date here is November 20th. Okay, so that's our first check. Then we want to do our second check. So we have, and we're checking it to the drug monograph here. So we have 0.9% sodium chloride. It is 50 milliliter bag. We are giving it through IV piggyback, which is safe, and it is the expiry rather is November 20th. So that's safe to give. And our third check. So we have 0.9% sodium chloride injection, which is what we're going to use for an IV piggyback. We have 50 mils, which is safe to use here. And the expiry date here is November 20th. So we're safe to use this. So now that we've done 3 checks on that, we can put a drug monograph just over here. The next thing we want to do is also make sure that all the medications Allison is on are compatible with normal saline or 0.9% sodium chloride. So what we're going to do is we'll just go through, I think it's easiest probably, yeah. We'll go through the medications on the doctor's orders here and compare them with the compatibility chart here. So we have ampicillin, and ampicillin on the first page here is compatible with 0.9% sodium chloride. We have dexamethasone, which is compatible with 0.9% sodium chloride. We have furosemide, let's see here, which is compatible with 0.9% sodium chloride. Ketorolac here, compatible with 0.9% chloride. Metoclopramide is, let's see, compatible with 0.9% sodium chloride. Pantoprazole is compatible with 0.9% sodium chloride. Ranitidine, last but not least, also compatible. So now that we know all the medications are safe and compatible, we can put the compatibility chart away here. And what we can do is do our medication withdrawal now. So we have the doctor's orders and the MAR here. I guess I could go over my supplies too while we're here. So we have the 0.9% sodium chloride, which we've done the checks on. We have, the lid doesn't really stay on here, but we have dexamethasone, our medication. We have a hand sanitizer, which I've used, alcohol swabs, which we'll need to take in with us as well. A sharps container here, medication label here, second line label here. We also have, for the assessment purposes, dry and intact, not expired, blunt fill needle. Excuse my dog. Obviously something's going on outside. There's also a 3 milliliter syringe that we'll need to withdraw the medication. Again, dry and intact and not expired. And then we have our secondary line here, and like I said, dry and intact and not expired. Okay, I'm gonna take you with me and we're going to shut the door here because who knows how long that could last for. Okay, so after we've done that, quieten the dog, I'll use hand sanitizer again. Make sure we're all clean here and dry here. We want to do our first medication check here. So we have a ward stock medication, but we have the MAR and doctor's orders here, and we know it's for Allison Chinook. So it's for Allison Chinook. It's dexamethasone. We're going to give 4 milligrams, so 1 milliliter of medication because it's 4 milligrams per milliliter, so that's easy math. We're going to give it through IV piggyback, and it's safe here, IM or IV. We're going to give it on today's date, October 26, 2020 at 1500. And the expiry date on here is October 2030. So have some time there, except for when we use the medication today, we'll have to change the expiry as well. And also we're going to give it to Allison for her chemo symptoms, which are nausea and vomiting. So that's why we're giving it. So first check. Now that we've done the check, we can swab the top. Even if it has the lid, you still have to swab. So we're going to swab for 30 seconds here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so now that we have that done, we're just going to wait for it to dry. And while it dries, we'll put the needle together. So we have the syringe here. We want to keep the tip of it sterile, and we can put this in the garbage, want to keep the end here clean, and we want to connect these two. Got to keep those ends sterile. And now garbage. We have this, and we can loosen the syringe so that we don't have medication squirting all over. Okay, so we want to safely take off the cap here. And then to withdraw medication in a vial, we're going to have to put in air to withdraw. So let's put in about 1.5 ml, 1.5 milliliters here of air into the vial. Push the air in, and then we will also expel that amount as well here. Okay. So we have the medication drawn up here. We just want to put all the bubbles to the top here. Perfect. And then we're just going to expel the excess medication, I guess you would say. And we'll just don't want it dripping back down the needle. So keep it on an angle here. We want 1 ml. Perfect here. And then we can recap here, and we want to recap safely using the sharps container. This one's kind of flimsy, so, and want to make sure there's, I see a bubble. Usually one tap is best instead of a bunch of small taps, but work for me. Okay, there we go. Oh, maybe not quite. One more. Still have a bubble there. Come on. Okay, can you see this now? And we have 1 ml there. Okay. So now that we have the medication drawn up, we're going to do a second medication check. So we have a word stock medication. We have our MAR here. We also have the doctor's orders underneath, but we're going to go towards MAR. So we have dexamethasone. We're giving 4 milligrams, so 1 milliliter. To Allison Chinook. We're giving it through IV piggyback. It's okay to do IVIM. We're going to do it at 1500 on October 26, 2020. The expiry date on the actual medication is October 2030, which will now change. And we're going to give this to Allison for her nausea and vomiting symptoms from her chemotherapy. So once we have the medication here, we've done our second check, we can swab here for 30 seconds the port of the mini bag, and we want to swap for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. So now we can inject the medication that we have here into the port that we have here, which we want to keep sterile. Okay, we want to insert all of the medication into the mini bag here. And we're just going to discard of this in the sharps container. So now that we have the medication in the bag here, what we want to do is write the medication label, okay? So we're going to write the medication label here. We have 4 milligrams of dexamethasone at 1500 on October 26, 2020 for Allison Chinook. We'll do here a Chinook by J. McClelland. There's the medication label here. And because I don't have an adhesive one, we're going to have to tape this one on. So for assessment purposes, we're taping this on, but it would usually just stick. So we have that there. And then we're just going to do another check here. So we have now 0.9% sodium chloride with 4 milligrams of dexamethasone. We're giving it 4 milligrams IV piggyback, which I actually should write on here as well. So IV piggyback, the root, that's important. So there's my label now, sorry, IV piggyback. So we have, that's why you do so many checks. So we have, for Allison Chinook, we have 4 milligrams of dexamethasone and 0.9% sodium chloride. We're giving it at 1500 on October 26, 2020. And we're giving it via IV piggyback by myself today, Jamie McClelland, and we're giving it on I think I said today's date, but we're giving it on October 26, 2020 at 1500, and we're giving it for nausea and vomiting symptoms from chemotherapy. So there's another check. Before we go into the room, we also want to bring our medication. We want to bring our secondary line here, and I'm going to fill out the secondary line label here as well while I'm sitting. So today's date, October 26, 2020. The time is 1500. My initial is JM. Secondary line. Secondary, and sorry, and the solution is 0.9% sodium chloride. There we are. Okay, so now that we have all of our things, what we want to bring in is tape, ID, secondary line, IV piggyback with medication, secondary line label, MAR, and doctor's orders. Okay. I'm just going to move this chair out of the way. I'll stay in the camera. And we're going to want to... Hi, good afternoon, Allison. My name is Jamie McClelland. I'll be your student nurse today, and I guess I could say nurse as well. And what we're going to be, or what I'm going to be doing is administrating your dexamethasone, which is for your nausea and vomiting from your chemo. And I know you had it this morning at 0900, and we're just going to give it 6 hours later, which is now at 1500. And so before I get started, I just want to put on the brakes here of the bed and provide privacy for us as well. Before I get started, I just want to check the actual IV line here. Maybe I'll switch sides here. So we have 0.9% sodium chloride running at, let's see, it's supposed to be 10 milliliters per hour. Perfect. And we also have this primary line labeled here, October 21st, 2020 at 0800. So hung this morning, and it's normal saline, and everything in here looks good. No kinks, nothing. And also looks like it's dripping and there's no air bubbles. So perfect. Then we also want to assess Allison's site. So Allison, before I assess you or your site, I just want to make sure I have the right person here as well. So if you could just tell me your last name, please. So we have Chinook, C-H-I-N-O-O-K. Perfect, thank you. And your birth date? December 11th, 1960. Perfect. And just in case we're going to check here, doctor's orders and MAR, that we have your ID band 614973042. Perfect, we have the right girl. I also just wanted to ask about your IV site now as well. So your IV site, we just are looking for any signs of infection. So arrhythmia, which is redness, edema, kind of swelling, bruising, which is ecchymosis, or any kind of itching, anything like that. I saw that you have no allergies. Do you have any food allergies even, or allergies to medications that we're unaware about? No? Okay, no allergies. Lucky you. We're not all that lucky. Perfect. Okay, so I'm glad that your IV site is reacting well to all of the medications you're getting, especially when you're going through chemo. We want to make you as comfortable as possible. So I do have the medication here, and I'm just going to do one last check here as well before I go ahead and assemble it here. So we have Allison Schnook, which is you. We have Allison Schnook here. We are to give dexamethasone here, 4 milligrams, IV piggyback at 1500 on October 26, 2020. Okay, so it all matches up here. And the reason, again, Allison, like I said, we're going to give it for your nausea and vomiting, okay? Perfect. Okay, so I'm just gonna put those down. And now I can open my second line. Just put this to the side here. And what we wanna do is, make sure it's not tangled first. Coming out of the package, perfect. And we have swabs here, and I just want to swab the port here for 30 seconds. So we're going to swab 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We also need to let that dry there. So we're going to let it dry for about 10 seconds. And what we are wanting to do here is undo this little blue cap from the secondary line and keep this sterile so we can connect the two lines here, okay? So once we have that clamped together, what we want to do is make sure that we're priming the line and that we're going to have, my bag is really low here, but what we want to make sure is that we have in the drip chamber here about 1/3 full, okay? So as you can see, I kind of drained this bag by accident, so we want to make sure. And so once we have it 1/3 full, we then can do the IV piggyback here, okay? And so we'll roll this closed. And what we want to do is first move this bag so that it's going to be lower than the IV piggyback. So we'll hang that there. We have this line higher. And then what we want to do is keep this sterile and as well as the port to the mini bag sterile here. So we're going to open here and we have the mini bag here, also open there. And then we can spike the bag here. Gotta really push sometimes to spike the bag. And then we can hang the mini bag higher, okay? And once we see some drips coming out here, we know the line's already primed and we just want to make sure that the drips are coming out because we want it to run from 20 to 30 minutes and we're doing the pump by hour. The drip will be 100 milliliters per hour. And so now we have no air or kinks in the line and we can open the medication to be administered now, okay? Okay, so before I leave, I just want to give Allison some teachings. I know you had them this morning as well from the other nurse when you had your dexamethasone given to you this morning at 0900, but I just have to reiterate and make sure that we have the same understanding of any signs of infection or anything like that. So again, at the IV site, we're looking for any itching or signs of infection, which could be redness, pain, itching, swelling, bruising, anything like that, and just let us know so that we can be aware of those kind of symptoms in case there is some kind of allergic reaction or infection, like I said, happening. Okay, so that just has to do with the IV site. And then with the IV itself, we do want to make sure the IV piggyback here is higher than the solution here, the secondary or the primary line. And then we also want to make sure that we have drips coming out, that there's no kinks here. So if you can kind of keep your arm in a reasonable place that works for you and keep it no kinks and things like that, that would be great. And with the medication itself, we just want to make sure that you know, like always, we only give medications if the pros outweigh the cons, but some of the cons are you might feel a little bit more hungry and also you might be having a little bit of trouble sleeping. So that can be due to the dexamethasone. I don't want you to be alarmed by any of those kind of symptoms that you're feeling, okay? So if you have any problems with the IV site, the bag here, or any other kind of symptoms, and even if you're feeling nausea or vomiting kind of, just let us know so we can make sure that everything's running properly here for you as well, okay? So before I leave, I'm just going to sign off on the MAR that I've given dexamethasone 4 milligram IV piggyback after Allison's chemotherapy to Allison Chinook at 1500 hours on October 26, 2020. And there's my signature there. Before I leave the room, I'm just going to apply the secondary line label here as well. Again with tape because I don't have adhesive, and we just want to do it under the chamber here. Oh gosh, hopefully this is tight enough. Oh gosh. Oops. Excuse me. Oh, maybe the right direction would be good. There we are. So Allison, I just want to clarify we're good on the teachings and you understand any signs of infection and everything. Okay, perfect. Before I leave the room, I'm just going to use hand hygiene. I showed you the MAR here. And I gave my teachings, and I'm just going to leave you the nurse call bell as well, just in case, okay? So here's your call bell, and I hope you have a good rest of the day and that the medication does help for the symptoms, okay? Thank you. Bye.